Are your teeth sensitive? If they are, and mine have been too, it is uncomfortable and it hurts. So we're going to talk today with Restart Hygiene, Becky Moore with a healthcare hygienist, about reasons for, 3 top reasons for, and 3 good holistic ways to reduce that sensitivity. So let's jump in. If you've had sensitive teeth, you know it hurts. It hurts to sometimes breathe. It hurts to chew your food. It hurts to brush your teeth sometimes. So this can be made worse by certain conditions that we're going to discuss. All right, so 3 top reasons for sensitive teeth. Number 1 is exposed root surfaces, the gum recession. When you're young, your gums come up to the enamel layer, the white part, and then they stop. They're healthy, they're pink, they're so good. But as you get older, certain conditions and certain habits can cause your gums to recede. So when your gums recede, that is called gum recession. That happens with age a lot of times, but it also happens for other reasons that we're going to discuss. But what it does is it exposes the root of your tooth, which is the dent layer. That dent layer has no enamel to coat it, and it is highly sensitive, especially when it's first exposed. So you want to make sure you keep things clean so that you can help that root sensitivity decrease. Second reason is you have a cavity, or you have decay in the root or the teeth. So you want to make sure you see your dentist. You want to make sure you keep healthy and stay in tune to your mouth. Your mouth is the gateway to your whole body health. You've heard about me talking. If you hadn't, then like and follow and share, and you'll see what I'm talking about. The third reason is clenching or grinding. This is called bruxism. The scary thing is with this, I'm finding when I'm talking to patients is they have no idea. And I did not for a long time either. I'm actually a clencher. I like to get in one spot and hold it there. Now, sometimes this can be stress management. Sometimes, or stress release, Sometimes this can be that your bite is off, that your teeth just don't fit together correctly. Your teeth are meant to fit in a certain position so that they last longer, they don't wear out earlier, they don't get sensitive, and they're all altogether healthy. And that's a lot of reasons why we do braces, not to make your smile prettier, but it is a great side effect of that. So I like to talk to you about holistic options and ways that you can help yourself. So I want to talk to you about the 3 good ways that you can help to reduce sensitivity. Oil pulling is on my top 3. The reason oil pulling is because it's antibacterial, it's antifungal. Now, when you keep your roots clean or whatever part of your tooth is exposed, which is the root, the sensitive, you want to make sure that it is kept clean so that it can get over being sensitive. Teeth are sensitive when they're dirty. When you go to clean the plaque off of them, they get really sensitive because they've been covered up by that layer of plaque. Remember, these teeth used to have gums up to the margin of your enamel. When you have gum recession, that's gone. So your dent now is standing on its own. The cleaner you keep things, the healthier you'll be. That is where coconut oil comes in, and also whitens your teeth, which is never a bad thing. An herbal mouth rinse. There are several herbal mouth rinses that can be very helpful to you. I'm a big fan of essential oils like chamomile and aloe vera are a couple natural ingredients, but essential oils are good too. Peppermint, spearmint, there's several of them, and I will talk more about that at a future video. But these mouth rinses can help to strengthen your teeth. They can help to decrease the plaque and bacteria. That's the culprit. When you don't keep things clean, they are more sensitive and hurt more. And then dietary adjustments. Your diet has a huge part in your mouth health. And so we want to make sure that we're getting the good vitamins. And we're talking about fortified with D foods, phosphorus, calcium. This decreases sensitivity. So look at your diet and make sure that you are getting proper nutrients. We've talked about that previously. I want you to go to my website and get I'm going to put on there a nutrition guide. So that will help you know what food you find these nutritions. My top 12 is in there. All right. And so conclusion, sensitivity affects your whole mouth. At some point, we all have some sensitivity. Now, I will tell you this. There's hot sensitivity and there's cold sensitivity. Hot, throbbing sensitivity usually means that the nerve inside of your tooth is changing. So hot sensitivity is usually a bigger cause of concern, raises a red flag when you tell us as dental professionals. Cold sensitivity can sometimes be just the fact that your roots are exposed or that you have a little spot on your tooth that's got a decay on it. Usually heat doesn't cause you a problem until the tooth is starting to, we say, go south. So that is when you want to make sure you check in with your dentist, your dental provider. Make sure you are checked. Make sure you have a proper x-ray so that they can diagnose any decay before it gets into your nerve. And you either have to, one, have a root canal, or two, lose your tooth, which is never a good thing. We want to keep what we got. It's really, really important. So I want you to shout, like and share and comment and tell me what you want to hear. I want to know more about what you guys want to hear. I'm trying to satisfy what I think you need, but you know better than I, so I would love for you to share with me. Go to www.restarthygiene.com, sign up.